Good afternoon, class. Today we're going to talk about a drug that's not used as much, but again, I want you to kind of be aware of it because they love to throw these questions in on come National Registry time. And this drug is dexamethasone, or known otherwise as Decadron. Decadron is kind of our what we call it. And it has other names, of course. You might want to just kind of take a quick glance at those. But again, Decadron is the big one that you hear it, and it's used to reduce the body swelling, redness, itching. And it actually works really good, especially drawing off that type of problem. It's, again, a corticosteroid, so again, it reduces inflammation that way. Again, it is a long-term acting. It fights the body's immune system, and again, it reduces that inflammation response. So again, and the big reason that we use it in EMS is to reduce the intracranial pressure that might be going on in a patient. It's kind of a short-term situation until it can be resolved. Usually, we give less. Its onset's usually less than 1 hour. So once we give this drug, it takes a while for it to start working, but it can actually take up to 8 hours to actually get the good effects from it just to onset. And again, it lasts for 1 to 3 days. So again, once you give it, it's going to be there for a little while to reduce the problems. You guys, again, we use it to control bronchospasms. We use it to control severe allergic reactions. And again, the biggest use in EMS is we use it to decrease that intracranial pressure that's going on in a patient. It's kind of like a Solumedrol in the fact that we give it, and we might not actually get to see the results of it actually working. So again, it's got several side effects. Again, you can have psychiatric reactions. Again, it's going to affect the brain chemistry a little bit. It's going to draw fluid off of that, so it could cause problems. It can actually send the patient into congestive heart failure because it draws fluid into the vascular space, and again, that's got its own series of problems with it. Again, nausea, vomiting is kind of a standard thing. That again, because you're changing the body fluid, body chemistry properties, so it's going to cause some problems there. And the other thing is, because it is a glucocorticosteroid, it can definitely send sugars right through the roof. Again, absolutely, we don't give this to a really teeny tiny baby. We don't give it to anybody with tuberculosis or any patient that has a severe fungal infection. Stay away from it. It can cause a lot of big problems. They got chicken pox, probably a good idea to stay away from them as well. Again, you got to watch out with our sugar levels. When you're given this, it's going to send sugars through the roof. And if you got an intracranial bleed, you might have even bigger problems once you get the hyperglycemia in there. Again, again, may decrease the blood levels of salicylates. So be aware of that. And again, therapeutic levels. So again, you got to watch out for the if they're on any type of antifungal type antibiotics, you got to really be careful when you're given this drug as well. So I would definitely try to get a med list or a history for that. Again, it can decrease the body's immune response, and it's less effective on live vaccines. So it can cause some serious infections if you start to use it like that. And again, using caution to patients with hepatic or renal disease, if they got any type of GI ulcers, and if they have diabetes, you got to really be careful because, again, it's going to spike the sugar. Again, lowers resistance to infection. So it's one of the bigger problems with using Decadron is you got to watch out for that. So usually give it 10 milligrams IV. And then if they give it by mouth, it's usually 1 to 2 milligrams by mouth. And they give it for up to 9 milligrams for a daily dose range. I usually give it over several sessions to build it up. And again, Decadron, it can be used for kids, but usually they'll stay away from it. And again, IV, IO, IM, it can be given. It can be given by mouth. And again, it does cross the the placental barrier. So again, watch out for could have some bad impacts on the fetus. All right, that's a quick overview of Decadron, and I will catch you all next time.